So what we're going to do is just go through this quickly. Appreciate everyone being here. As you know, we've got a session, and I think it's starting Wednesday, and this is about the CARES Act appropriation. And what we wanted to do was to hear from Executive Budget Office and Brian Gaines and more, and also Godhouse, who is the consultant, to kind of tell us how the process is, grant management, how it's going to go, and what we're to expect. So if we'll just kind of limit our questions to this, to the process of what the Executive Budget Office is in charge of, and or the consultants through Godhouse, I appreciate that. And then we'll talk about the Senate plan. If y'all got any questions, I'll be available for those afterwards, and make sure you discuss it. Hopefully staff has sent to you, to all your emails, a copy of what the Senate plan is. And I'm calling it Senate plan because that's what they're starting the process, and it's over in the House. This is in essence almost identical to what the governor and Accelerate SC has proposed, and the Senate's going along with that, and been kind enough to send it to us for us to review before we go into session on Wednesday. So with that, I want to introduce Brian Gaines. Brian, you there? Can you hear me?
Yes, sir.
Okay, I want to introduce Brian. We all know Brian, Executive Budget Office, and we're going to let him say a few words and see if there are any questions for him. And then he's going to introduce Godhouse and make sure that they can help us through the process and how we anticipate this to work under the framework as proposed by the governor and the Executive Budget Office, and where the Senate's heading. So Brian, I'll turn it over to you, sir.
Thank you, sir. I'm actually going to walk you all through a brief PowerPoint. So give me 1 second. I'll see if I can figure this out. Okay, so we're going to talk about the CARES Act, which is the Coronavirus Aid, Relief, and Economic Security Act. This is federal legislation that was signed into law on March 27th. It provides over $2 trillion of direct economic assistance for workers, families, small businesses, state and local governments, with the #1 goal of preserving jobs for America's industries. The biggest pot in which will be subject for authorization by you all when you return this week is the Coronavirus Relief Fund. This provides over $150 billion in direct aid to state and local governments. How it works is each state receives a minimum allocation of $1.25 billion plus an enhancement based on your state's population. Based on South Carolina's population of just over 5 million, our share is $1.996 billion. Local governments with populations of 500,000 and above can apply directly to the federal government to receive their direct allocation. We have one local government entity in South Carolina, that's Greenville County, that meets that threshold eligibility criteria, and they have applied and received a direct allocation of $91 million, which leaves $1.095 billion that will be subject to authorization by the General Assembly. There are 3 high-level criteria for use of the funds. The funds must be necessary due to the public health emergency known as COVID-19. Those expenses could not have been accounted for in the most recently approved budget. And those expenses must be incurred between March 1 and December 30, 2020. A couple high-level uses of these funds. It can be for medical expenses for things like testing and treatment of COVID-19, public health expenses, the cost of quarantining individuals or purchasing and distributing PPE, payroll expenses for public safety, first responders, and other direct care employees, compliance expenses, things like technology and telemedicine, providing economic support. That could be a deposit into the UI Trust Fund to cover those expenses for benefit payments related to COVID-19, or creating a small business grant program. A FEMA state match, the 25% match that's required by FEMA, could be funded out of the CRF, and any other reasonably necessary COVID-19 expenses at the government's decision. Some high-level unacceptable uses would be, obviously the largest for us, revenue shortfall and replacement. These funds cannot be used for that purpose. Damages that could be covered by any other insurance, the Medicaid state match, payroll for employees that are not dedicated to COVID-19, expenses that could be reimbursed by another federal program, reimbursements for any donated items or services, workforce bonuses, severance pay, and any legal settlements. So as a part of the Governor's Accelerate SC initiative, the Executive Budget Office conducted a statewide survey to get an idea of what the overall cost impact was going to be to state and local governments. We received a total of 207 responses coming from state agencies, all of our public higher education institutions, counties, special purpose districts, municipalities, as well as MUSC Hospital. We surveyed them differently from the university. And you can see those entities all responded with their actual expenses as of the date of the survey, which was May 18th. Those entities had spent $282 million that could be deemed to be related to COVID-19. If this continues to progress into the fall and the winter, we also asked those same entities to provide us some projections through the month of December. And those exact same entities reported to us that they are projecting spending $632 million through December 30, 2020. I will say a caveat here. These reimbursements were as reported to us by these entities. They've not been vetted by the Executive Budget Office, nor have they been properly vetted by the third-party grants administrator in which we have hired. Once that process is undertaken, obviously these numbers could go down or go up as it relates to that particular process. A couple other things I'd like to mention. Included in the CARES Act and the 3 subsequent pieces of legislation that have been passed by Congress, there are over 50 different sources of funding that will be coming to the state of South Carolina, totaling just over $3.5 billion. I say that to say that it's going to require some significant coordination to ensure we're maximizing the benefit of all of these available resources for the entire enterprise. As I mentioned, 50 different pots of money, over $3.5 billion, all related to COVID-19. It's being the best interest of the state to ensure we are maximizing that, to ensure we're getting all we can to support the citizens of South Carolina. To help us do that, in accordance with Act 135 of 2020, that's the continuing resolution that you all passed just recently. The Department of Administration has hired Guidehouse to be our third-party grant administrator. Guidehouse will provide various services for the state, largely centered around maximizing the use of these funds, avoiding any duplication, and coordinating benefits across those 50 funds in which we've mentioned. The contract includes a couple high-level services to include the development of an overall grant assessment and strategy, designing an end-to-end grants management process, development of an online application portal. There will be over 500 potential subrecipients, and once you take into account all of the cities, the counties, the state agencies, all of our special purpose districts, our higher education institutions, there could be over 500 individual entities that could be submitting reimbursement requests, and Guidehouse will stand up an online portal that would allow us to collect all of the information online. Direct assistance to any subrecipients, so that's going to be our small cities and counties that are out there that could need some direct assistance in how to package their reimbursement requests. We will be providing that direct assistance to those individual counties and cities. Collection and determining eligibility of reimbursement requests. So going back to the survey that we conducted, each one of those individual requests will have to be submitted with documentation. Guidehouse will then vet that to determine whether or not it meets the eligibility criteria as determined by the federal government, to ensuring that we're not essentially spending money that we are not allowed to spend it on and run the risk of having to repay that money to the federal government. And finally, with grant reporting, compliance, and monitoring, essentially ensuring we're doing all the things we're required to do as required by the federal government, and also making sure the state is prepared for the eventual federal audit that will come as a result of receiving these funds. So at a high level, that's an overview of the CRF and kind of the steps that EBO has taken to date. Guidehouse is on the line as well, and they will provide a overview as well, Mr. Chairman.
All right, thank you, Brian. Before we get into hearing from Guidehouse, does anybody have any questions of Brian? All right, Brian, I presume silence means there's no questions, so great job. All right, we'll hear from Guidehouse. I don't know who's speaking on their behalf, but if you'll recognize them for me, Brian.
Yes, I believe we have.
All right, somebody's asking a question. Who is it?
Me, Cobb Hunter.
Imagine that. Welcome, Ms. Cobb Hunter.
I think she's on mute.
You're on mute. Gilda, you're on mute.
Am I?
Yeah,
Can
there
you
you
hear me
go.
now?
You're good.
Okay. Sorry, Mr. Guidehouse guy. I'll make it quick. Brian, one quick question about payroll expenses. Under direct care, who exactly falls under that? And I'm asking specifically because I'm concerned about employees who have to go back to work and are not being provided with PPEs. There's something that we're going to be doing so that these service workers, for example, who have to go back to work, there will be an ability of their employers to buy this personal protective equipment for them. My question was about direct care, and if you need to get back to me on that, that'd be fine.
I can begin, and then maybe Mike or Gaurav from Guidehouse can further elaborate. So it's going to be any employee that is providing a direct COVID-19 related service. It could be medical providers, any of our, perhaps some social services employees, employees that are essentially performing a duty that is having to be done as a result of COVID-19.
So that would be like environmental services people at the hospital, the janitorial staff. My question specifically is about private employers who hire, let's say the service industry, housekeepers, people who are going back and forth to Hilton Head and Myrtle Beach to clean rooms, cook, that kind of thing. I'm concerned about the equipment being provided to them.
So for PPE,
you can get back to.
Okay.
All right, Brian.
Okay.
Anyone else have any questions? All right, Brian, if you'll introduce the Guidehouse folks and who's going to take it from here.
Yes, I believe we have Mr. Mike Tosh, Mr. Gaurav Menon, and I think Vinod is on as well, but I believe Mike is going to kick us off.
Actually, Brian, it's Todd Hoffman, and I will go ahead and kick off.
Oh, sorry about that.
That's okay, no worries. My name is Todd Hoffman. I'm a partner with Guidehouse. I lead our Southern region, state and local government practice. I've got more than 33 years of experience servicing state and local government across the country. I currently lead our COVID-19 response nationally for Guidehouse. And my role on this project is, and first of all, I'm an accountant by background. And my role in this project is I'm going to serve as the quality partner. What does that mean? In this role, I will be putting together a strategy and methodology to around funding strategies and grants management and our grants management approach in order to ensure we have the appropriate compliance as well as to avoid any de-obligation of benefits. With that, Gaurav, you want to introduce yourself?
Sure. Thank you, Todd, and good afternoon, everyone. Gaurav Menon. I'm a partner in Guidehouse. I have over 19 years of experience in dealing with disaster response and recovery activities at the state and local level, as well as private not-for-profits, and have dealt with all sorts of federal funding from FEMA to HUD to USDA to ARA and the whole likes of it. So really worked with Todd in designing the COVID response strategy and how we're working with South Carolina to do what Brian just said, which is maximize the benefits that you're receiving from these 50 grants, isolate correctly what are the eligible activities for the CARES Fund or the CRF Fund, the $1.99 billion, and then to do this in a compliant fashion so that we can leave South Carolina better off than where you started, but also to make sure that there is no drawback or clawback of funds from the federal government for ineligible expenditure. So looking forward to working with you and answering any questions you have today.
Let me go ahead and click the next slide, Brian. There we go. Right. Well, let me, and Brian kind of did a setup here as it relates to what South Carolina has hired us to do. But I wanted to take just a few moments to kind of give you a bit of background about how we service these types of projects. First of all, as you can see here, we're doing COVID work in over 32 states. We have over 40 health systems that represent about 400 plus hospitals, and we're doing this currently at 14 kind of state, local, large municipalities across the country. And I say all that to say that, you know, we have over the last 15, 16 weeks have designed a process that mirrors a lot around the disaster recovery work that we do, which is a core business of ours that we've been doing for decades. And so we understand how funding strategies work. We understand the compliance and the methodologies around that. And what we have done here is we've created a center of excellence where we have over 250 people within Guidehouse that actually serve both the state and local side as well as the healthcare side of this type of work. And that way we're bringing together the funding sources that are focused in on government, but we're also complementing that with the health system strategies, which are a little different, to help ensure that we are maximizing the benefit for South Carolina and avoiding and minimizing that duplication of benefit, which then, as Corral stated earlier, leads to potential clawbacks, if you will. So as you can imagine, this is a very complex issue where you have funding, over 50 plus funding sources that are out there with different rules associated with them. And so the value that we really bring is how we have dedicated folks, as I mentioned, in that Center of Excellence, that are focused in on what's happening daily out of the Treasury, HHS, HUD, FEMA, CSD, and as well as other agencies, both at the federal level, as well as the information that's bubbling down at the state and local level to ensure that we are up to speed. And as you can imagine, these things are changing daily. And so, and that's what's so complex about this, is that information is coming down regularly, and therefore we have to ensure that we're getting that information out to our clients on a very, very regular basis. So just to give you a little foundation around how we service these types of projects, Gaurav, you want to go to the next slide? Or Brian, please, and then Gaurav, you want to speak to it?
Sure thing, Todd. So basically, based on what Brian and Todd have said, the whole purpose of working with South Carolina is very quickly in the first 6 to 8 weeks is to design a strategy. That strategy will take into consideration all the different funding sources that are coming in. What is the Treasury providing from a guidance perspective for the eligible use of funds? As you may or may not be aware, but those guidance are changing. Frequently asked questions are being updated, and a lot of new information is coming. And this is true for a lot of federal funding agencies. In a typical disaster, what happens is you have funding agencies that come in after a fact and deal with it, and it's taken care of because you're dealing with the aftermath. However, with COVID-19, the difference is that this is evolving. It's an ongoing pandemic. And so guidances are evolving on a day-to-day basis, especially the key agencies where we're seeing this change happening is HHS, which is providing a lot of significant amount of dollars to the healthcare systems and to hospitals. We're seeing this with the Treasury. We're seeing this with FEMA as well. So what we're doing is making sure we're keeping up to date with all these evolving guidances that are coming down from the federal government, and then helping the state create a strategy on how do we formulate what the use of the CRF funds are. At the same time, because this is an event where you're going to be providing assistance as a state to over 500 subrecipients, your state agencies, your municipalities, your counties, your special purpose districts, we're talking about a lot of information that has to go back and forth and has to be reviewed and checked for eligibility for this process to work effectively. So in the same 6-week period, we're going to be working on that end-to-end grants management process that will be dependent on the strategy. And we have a platform, this web-based platform that we're going to be using. It's going to be simple. Every subrecipient will have access to this platform. It is a workflow process. So basically, we provide the training and the assistance to these municipalities, especially the smaller municipalities and special purpose districts, and train them on what they need to be uploading to this web-based platform. And that way, the state has all the documentation and all the requests for reimbursement in one place, accumulated in one place, which helps from a reporting standpoint. It helps from an analytics standpoint, because a lot of the data, especially when we start looking at the projections that these subrecipients are going to have, if this pandemic is going to continue beyond December, what next? What are the needs? What do we need to be anticipating? And how can the state of South Carolina be also taking this up eventually to the federal government if the need does arise post-December for additional funding that the state may need? So that's the whole purpose of the first 3 tasks that you see. And then once that is established in that 6 to 8 week period, then we go live. And basically what that means is we open the portal, we have a webinar where we explain the process to the subrecipients. We have frequently asked questions, we have checklists, documentation requirements, all presented to them. And at that point, they can go ahead and start submitting for reimbursement requests to the state following the strategy that was defined. Brian, if we go to the next slide. So basically, Brian already mentioned this. I'm not going to spend a lot of time. We know that you received $1.99 billion from the CRF funding. We also know from the other 50 different grants that came to the state of South Carolina and to pretty much all state and local agencies, you had an additional $1.65 billion. The one unknown factor is FEMA. Currently in the CARES Act, there's about $45 billion allocated to FEMA, but FEMA is typically a funding source that doesn't have a cap. In the sense, if you are an eligible applicant and you have eligible expenditures, they typically have been, in the past at least, been reimbursed by FEMA. And so I think that's the biggest risk and the biggest opportunity for the state, because if you look at the CRF funding, which is the $1.99 billion, and then if you look at the FEMA eligible activities, there's a significant overlap on what is allowed. So for instance, PPE is allowed in both and in several other grants. So is some sort of payroll, especially overtime and hazard pay. So the fact is, how do we make sure that we're maximizing the eligible dollars of FEMA coming into the state and supplementing that the 75% that FEMA typically reimburses and adding 25% from the CRF funds to put in for the state and local match. So that's basically the strategy piece, which is coordinating these benefits. And Brian, if you go to the next slide. So the 2 important pieces, once we come up with this strategy and once we design the platform, is you will see the 2 graphics. We stand up a grants management platform. This has been tried and tested. It has been developed. It's currently working in about 4 or 5 different states. Florida has been using this for a very long time for the natural disasters as well. So we're not custom designing anything new. All we're doing is taking an existing platform and just configuring it to the needs of South Carolina. And so this process is going to make it really efficient. It's going to avoid a lot of emails going back and forth because it has a workflow and a communication platform built in. So any questions coming from the subrecipients or any requests for additional information that the state may have can be tracked easily through this one centralized source, which then gives the state the ability to not only control the communication and the speed with which you can serve your constituents, but it also helps from an audit perspective because every single back and forth in the workflow, in the questions, any changes made to a request are all tracked and documented from an audit perspective. Because we fully anticipate that even though the federal government is giving you a very, very expedited timeline to spend these funds between now and December, so there's not going to be a lot of oversight right now. We do anticipate fully that 2 years, 3 years down the line, there is going to be not 1, not 2, but several auditors from all these different granting agencies coming knocking on everyone's door saying, can you please explain how you spend these funds and how did you make sure that the same activity was not paid for by multiple different funding sources. And so keeping that in mind and keeping that conservative approach that we want to make sure and we want to protect the state of South Carolina, we have this platform and then we have a compliance program. This compliance program will be based on a risk assessment and it will be based purely on audit readiness. And at the same time, we don't want to go overboard with the compliance, the fact that the CARES Act and the CRF funds came in with fewer strings attached than normal federal funding is because the federal government understands that the need is now. I don't think we have time to wait 5 and 6 months to design and develop a program and make it, comply with what typically is done in the federal government. That being said, we use a common sense approach. So in absence of a lot of strict guidance, we're working with the budget, with the executive office and the budget office to kind of figure out what is that risk appetite. We're working with the legal team to understand that, create a risk-based methodology so we can protect the state of South Carolina. And that way, at the end of the day, we make sure that you're audit ready, the documentation is audit ready, and all the expenditures are tracked and reported correctly. And I think if you look to the left, you will see those graphics, even though that's just a snapshot right now, because this is taken from another community that we're working with. But this starts giving you insight. And I think that's where I would like this members of this committee to also focus on, is that this tool and the kind of documentation and information that we're requesting is also going to help build the case for what's next for South Carolina coming out of this pandemic. Next slide, please. So these are the 5 steps. So what we did was basically what I mentioned to you, which I'm just going to very quickly spend 30 seconds on this. We've come up with 5 priorities to our approach. Step 1 is coming up with that assessment and that unified approach to maximize funds, which is what we're currently working on. We're actually deep in that process right now. The 2 is the tracking and accounting, which is the platform. That platform, as and when the decisions are being made by the state with the recommendations that we're providing, we're starting to build that platform and configure the platform to get ready. The 3rd priority is communications. Now, dealing with 500 different subrecipients with varying needs and varying degrees of sophistication and knowledge in using these systems and using federal dollars, it's going to be critical, as Brian mentioned when he first spoke, is to provide that training and that education to the communities that need it the most, who haven't dealt with federal funding, who are not very familiar with technology to be able to access these funds. Because we don't want the funds to go only to people who have that background and the ability to do that. This needs to go to every community because the need is everywhere. So providing that channel of communication, providing call center support, providing office hours, so we can address the needs of the community and help them actually put their reimbursement packages together and submit it to the state. And then in turn, if there are questions that need to go to the federal agencies, whether it's Treasury, whether it's FEMA, we can also provide that conduit to having those communication channels and getting any questions or queries answered by the federal government. When it comes to reporting and compliance, again, there is not a lot required currently by the Treasury for reporting, but we've seen this time and time again that in the past that the federal government has required reporting. And since we're building this on a platform that automatically creates those reports, it's not an added effort, but we think that it is a worthwhile effort because you can start seeing progress of where these funds are going, how they're being spent, what are the additional unmet needs that your communities have, and then how do we make sure that we use this common sense approach that I mentioned so that we can prepare for what we consider closeout on day 1. And then finally, integrated into all these 4 steps will be that guidance and training, whether it's training the state agencies, whether it's training municipalities, special districts, or cities. We provide that guidance and training on an ongoing basis. And the reason we do that, and it's part of the process that we do, is because we see that there's increased compliance when this kind of guidance and training is provided to the subrecipient.
And if I may, Gaurav, on step 4 around reporting and compliance, that closeout on day 1 is a really, really important point, because the way that we do our work is we will be doing many audits as work is being performed over the next 6 months to ensure that all the documentation is there. It followed our methodologies, our approaches, et cetera, to ensure that by 12/30, given the current deadline, that you are audit ready as you move into next year. So we understand how this works. We've worked with all the different federal agencies as it relates to their auditors and that have come out through our disaster recovery work. And so we understand what it is they look for, ask for, how it needs to be documented. And we will make sure that that will be part of what occurs here and will also be in the system that Gaurav stated earlier.
Thank you, Todd. Brian, the next slide, if there is one. Well, I guess that was it. So, you know, we're standing by for any questions that you may have. We're happy to answer them.
All right. Does anybody have any questions?
Chairman, I do. This is Alan
Okay.
Clemens.
All right, Alan, go ahead.
I'm curious as to whether there'll be a pre-clearance process for subrecipients to help all local entities minimize the risks in the allocation and expenditure process.
Yes, and the answer is yes. That's exactly what we're working with the state right now, is to identify what that pre-clearance process is and how do we narrow, because if you look at the CRF funding, there are 22 eligible categories, and there are about 5 or 6 different categories eligible activities within the CRF funding that actually do not have any sort of duplication. What I mean by that is that those are activities that no other grant funding source is actually providing benefits for. And so how do we actually create a process that gears towards a quick response to the municipalities and pre-clearing those expenditures, especially because we know already that there is no duplication possible in those cases, and for the other expenditures. So for expenditures that do have multiple funding sources, coming up with a strategy of educating the subrecipients that, you know, for instance, if somebody says that I need money for PPE, how do we provide them that training and guidance upfront before they submit their reimbursement, highlighting to these municipalities that you have 4 other funding sources for PPE. Have you requested that funding? What is the amount? Are you asking for something incremental that has not already been covered, which then avoids that duplication and helps the municipalities maximize?
Excellent. Thank you very much.
Sure.
All right, any further questions? Anybody else? All right, with no further questions, appreciate that presentation and thank you guys for your work. Look forward to working with y'all. I can say this as someone who was involved, I guess, from the inception about trying to make sure that we get some assistance in the grants administration. I really look forward to working with you all. Glad you're taking the heavy lifting off of us at both on the legislative and executive side. So look forward to having y'all to make sure that we are in compliance with the CARES Act, and hopefully we won't have any hiccups throughout the process. So thank you for your work and look forward to that.
Thank you.
Let me just say, sorry that somebody speak. This is the problem with these virtual meetings. We sometimes talk over each other. Let me just conclude to tell everybody, as we look through this, I mentioned earlier, staff has sent to you what we have anticipate to be the majority of the CARES Act authorizations that we're going to do. I've talked to a number of you individually and a number of members individually throughout this process, just so everybody understands what we're doing here is what we're going to try to do is have broad strokes as it relates to the appropriations, or not appropriations, more over the authorizations. And so a lot of the work is going to be authorized, and then it's going to be up to the individual agencies, especially the EBO, to consult with Guidehouse and trying to make sure that we reimburse all those agencies and local governments and other governmental entities that are eligible on the CARES Act. And then we're going to try to continue the statewide testing. You'll see in there about the K through 12 education, and then the unemployment trust fund that we've heard a lot about, the PPE and some hospital relief. And then most importantly is the broadband mapping and planning. That is something that I'm very interested in. I know a number of you all are very interested in the broadband and making sure our rural areas have access, because that is really a problem that we foresee as we move forward with this, especially, unfortunately, we're seeing an uptick in the infections, and, you know, we're 7-8 weeks from, if that, from school starting. So I want to make sure that that we have ability to take full advantage of this broadband funding that we have. We hope that there's going to be more broadband funding. So, I want to make sure that we work through this. We still are trying to work on what the process looks like. I don't think anybody's got any idea now. So if y'all have ideas, please work, talk to Daniel and about this, and Katie, because I think this is an area which we've got to get a plan in order to have this money put out into the areas that need it. And what I'm interested in, probably those of y'all from the rural areas are very interested in, is what we call the hot spots, or the areas that need that access and more than anyone else. So we're going to look at that, and that's going to be a work in progress. We're not going to resolve that on Wednesday, but that is something that I think all of us need to work towards as we move forward with this. So with that, I'll be happy to answer any questions that you all may have on it. Hopefully you've got this, and we're going to continue to try to work through this process. As you see, the Senate authorized $1.237 billion. So there's $668 million remaining after this for us to go to phase 2. If that's the amount that's adopted, it could be more, it could be less. It just depends on how it works through the Senate and works through the House on the expenditures of money. So I'll be happy to answer any questions if anybody's got any. Nathan, I'm watching you eat. Are you enjoying your snack?
Some energy with my gummy bears.
Okay. You and the speaker eat gummy bears. All right, Ms. Cobb-Hunter.
Thank you, Mr. Chairman. Just a question about what changes likely might happen on the House side. Are we pretty much, before I expend too much energy into this, are we pretty much looking at what the Senate has done as a pretty solid product, or will there be opportunities for tweaking that?
I think we're going to hear from the membership as this gets circulated. I think that this is probably a fairly good product. It's in line with Accelerate SC with the governor's recommendations, and so there's not much difference in those. And so, I anticipate that this will be the vast majority of it, but I'm certainly open to tweaks. And, we're still looking at the language. As usual, the Senate, doesn't send us the language till the last minute. And so the language details matter a little bit, as you know, Ms. Cobb-Hunter. So hopefully they get us that language here quickly, and we can review it and see if there's any devils in their details. So that's what I'm waiting on. Okay.
Are you interested at this point in hearing our thoughts, or you'd rather we wait until Wednesday?
Well, I'm interested in hearing your thoughts now. I mean, you can do it now, or you can call me, whichever one you want to do, because I'd rather hear them now than on the floor.
Yeah, real quickly, and because I haven't had a chance to look at the document, unlike my colleagues, there are two things that I'm concerned about. One is this notion of PPEs for employees who are in the service sector. I really would hope that there is a pot of money available for private employers. I mean, we were all interested in the hotels reopening, and so I'm concerned about workers, because we haven't even gotten to the spike yet. So I'm concerned about that. The other piece I can't remember. Oh, the other piece, I heard something about hospitals as far as the care and those who are being reimbursed. I am really interested in us having a conversation about adding language, not dollars, but language, which would allow the federally qualified health centers to be a part of that, as well as the mobile health units. There's a mobile health unit in the district in the Charleston area that has been trying to get engaged in providing testing and has not had much success. So I'm interested, I'm all for the hospitals, but they are not the only ones who are expending resources, and would like some conversation at some point about adding language, which would allow at the appropriate time federally qualified health centers and mobile units to be considered. Those are the two. I'm really concerned about employee. And the other thing I heard the consultant talk about hazard pay. One of them mentioned that. I would hope that we could have some conversations about that. We talk about workers being essential. I see Nathan smiling. We talk about workers being essential, but the best way to tell these essential workers that they are indeed essential and not just expendable is to give some hazard pay. Thank you, Mr. Chairman.
All right, thank you, Ms. Cobb Hunter, and you and I talked about those mobile clinics, and we're working on that for you right now.
Okay.
So I'm with you. We'll get that squared away. I think Brian will probably talk to you. Brian, you can help her with the private employers and the PPE.
Yes, sir.
Okay. If you have a discussion with her on that, and I think you're probably we'll talk about the others, Ms. Cobb Hunter. I think you're
Thank you,
involved.
Mr. Chairman. Thank you.
Anyone else?
Mr. Chairman, this is Alan Clemens.
No.
Please.
No. You already asked one question. That's one too many for you.
I understand. I'm going to go over that limit. At least you can't see me eating my gummy bears right now.
Okay.
Just a couple of things. I sent a more detailed letter to your office this morning with a copy to Daniel, so he's got this in front of him. But one thing that the coastal communities are very concerned about is how do we deal with hurricane evacuation with COVID-19 going on? FEMA contribution is a 75%, 25% match. And there will have to be new facilities brought online for evacuation purposes, for housing folks that are stranded. I think we need to address that. I think none of the local coastal communities are prepared for that kind of expense. Additionally, when you look at what Greenville has done with their funding allocation, they've dedicated $75 million of that towards assisting small businesses. Our small businesses are dying on the vine because of COVID-19. I think it would be appropriate for us to be taking a look at how the state can step in and provide some assistance to those businesses. That's it, Chairman.
All right, thank you, Mr. Clemens, and let me respond just to let you know is I'm not so sure about whether the hurricane evacuation would be eligible for CARES Act. We'll certainly look into that. As it relates to small businesses, I probably should have said this in the beginning. I think I've told each of you individually who've called me is that, the game plan is for us to fund what we needed to fund right now, and then come back with our September when we come back for the budget and have the remaining money authorized at that point. So I see everything now as trying to catch these entities up with what they need as reimbursements at this point. And the one thing I would mention in small business relief, as you can see, there's a recommendation that there's $500 million placed into the unemployment trust fund. I think Ms. Clemens and all of us know that the people who pay into that trust fund are businesses, and by and large, mostly small businesses here in South Carolina. And so that is a big asset was made to the Accelerate SC people, and I understand a lot of requests for that in the Senate too. So that is some form of relief to our businesses, because if we weren't doing that,
Mr. Chairman, you've muted yourself.
We can't hear you, Mr. Chairman.
Somebody get him a gummy bear stat.
yeah, I need a gummy bear. Daniel walked in here. I'm sorry. I was just responding. I said, Alan, I don't know if you heard me say on the two things is first, I don't know. We'll look into whether CARES Act is funding can help with evacuations. I'm hearing a lot about that from coastal communities, especially hospitals and nursing homes. So we certainly will look into that. And secondly, small business relief fund. I think I was saying I failed to mention at the beginning, what we have done is spending some of this money, but that is necessary for reimbursements as a result of the CARES Act, hoping that it was going to subside to some degree and that we could look at the remaining dollars, and we'll certainly look at all programs and consider things when we come back in September to authorize the remainder of the CARES funding. I would say that the $500 million of the trust fund is certainly something that every business would receive if we didn't do that, and they had to be a replenishment of the trust fund, which it likely is going to have to be. Then every small business, every business, including small businesses, which make up the vast majority of our employers in the state, are going to have to pay that. So, that's a big step forward to trying to help small businesses by not making them have to contribute by the end of the year or the beginning of next year with replenishing the employment trust fund.
Thank you, Mr. Chairman.
All right, any other questions?
Mr. Chairman.
Yes, sir, Mr. Clobber.
Yes, sir. Mr. Chairman, I just have a couple of quick things I want to mention. But first of all, thank you. I know you spend a lot of time with what we're confronted with. But let me just ask you, the state agencies, are there going to be, and we can talk about this Wednesday, or I can call you on this, but I do have some concerns about, coordination. Will legislators be familiar with what is happening with the agency? Will they be coordinating that with us so we can be aware? We get a lot of questions, and constituents expect to get answers, and they expect to get some assistance. And just want to mention to you too, and of course we can be prepared for this Wednesday, or I can talk with you personally about what Resident Carver mentioned, and you know how I feel about the rural areas, and I have some concerns about how much input the health centers and the motor health units and the hot spots, Mr. Chairman. I just want that to be on your mind, and we'll talk about this in details as we move on.
Yes, sir. Thank you, Mr. Clobber, and please call me on that. And you and we've been together for a while on those committees, and I share your concerns with rural health care and especially the hot spots. And unfortunately, we all see Greenville's a hot spot for COVID now, but areas which were hot spots. So fortunately, we've done a good job with testing. Now we just got to do a little bit better job of getting the messaging out to people. And state agencies aren't responding to you, Mr. Clobber, and please let me know, and we'll have a discussion about that offline, because we're the people, when all of us know when somebody in our district needs some assistance, we're the ones that they call. They don't call the state agency because normally they can't get through them. They don't call the governor's office. They call us, and and they dadgum better return our phone calls and get information, because that's what people elect us to do. So if that's not happening, we'll be happy to have a conversation with that agency. So I'll be glad to talk to you about that, Mr. Clobber.
Thank you, Mr. Chairman.
One quick question, Mr. Chair, before we leave.
Yes, ma'am.
The broadband. I saw in the paper where the Senate is spending money on broadband. My concern is that there is whether or not there is a defined plan for how that money is going to be spent, making sure that the focus will be on underserved areas. I'm just curious as if there's a plan. And then my final question is not a question, but a comment. I see Gary Smith is on this call. Greenville already has their money. So are we interested in what folk from Greenville, are they going to have a say in how we spend the money since they already got theirs off the top, Gary?
Well, unfortunately, they got a vote.
Gary.
Ms. Carbonner, unfortunately, they got a vote, so we're going to have to let them have a say.
Oh, shoot. Thank you, Mr. Chairman. Sorry, Gary.
You're muted again, Mr. Chairman.
Well, somebody's muting me on purpose. So I did not unmute. I did not put myself on mute. I said, unfortunately, Ms. Cobb Hunter, Greenville has a vote on this, but we don't have to listen to what they say. I'm not going to allow. The speaker says they can't take the podium, especially you, Mr. Smith. So, and on the broadband, you and I talked about this, Ms. Cobb Hunter. No, we don't have a plan, and we're going to get a plan when we get out of here. We have to do that, and I am committed, and I think the Senate and the governor, from my discussion, is committed to the rural areas of the state. I understand metropolitan areas also have that, but as you see with the distant learning and things to that effect, and the mobile hotspots, we have to attack that now, and that's going to be a priority, and we're going to have to figure out how we work on that. We're working with Senator Alexander on that and see what his thoughts are, but we're going to get that done. All right, any other questions? I see Mr. Huggins is putting on sunglasses, so that must mean his call's over.
Mr. Chairman.
Yes, sir. Dennis? Yep.
Thank you for the update, but I just, I want to chime in with Representative Gilda Cobb about the broadband. The rural areas, even though we're in the upstate, in the shutdown, they were driving buses around and parking buses just certain hours of the day, and maybe it didn't fit with the parents that they could get the kids there or whatever. So, I was asked this at church Sunday, is there going to be a rush to get this broadband? And I get the email from the co-ops that they support it. Is the co-ops going to help do this or what?
That therein lies the problem, Mr. Moss. That's why we have to have a plan, and we're insistent to get a plan, because everybody's got a solution, but nobody knows who's in charge. So we're going to have to get that done, and we're trying to work through that with the Senate, and and if y'all got ideas, we got ideas. But the worst thing that I'm concerned about, and I'll say this and I'll say it, I know we're being streamed live, is you got the co-ops, you've got the telephone co-ops, the electric co-ops, you've got the cable industry, you've got a number of other stakeholders who have all called and said we can fix that. And the challenge we're going to have is bringing them together rather than having them fight, because as you know, if we get into the lobbying and everybody starts drawing lines in the sand, we're never going to get anything done. So I'm not interested about whose proposal we are. I'm interested about collaboration and getting this thing done, because we're going to lose a golden opportunity if we don't get broadband in the rural areas. So I hope that we stand firm as a body when we we take this issue up, and we demand that there's going to be a plan and just not a promise.
I agree totally.
All right, any other questions, guys? All right, Nathan, you can go back to eating your gummy bears.
Thank you, Mr. Chairman.
Coach, you can go back and coach another state championship football team if you ever get to play football. All right, guys. Thank y'all so much. I will see y'all tomorrow. Ms. Cobb Hunter, Mr. Clemens, Mr. Stavronakis, Simrel. If y'all, I talked to the chairman on the way over here today of JBRC, and if y'all want to call in and not come tomorrow, we can accommodate that. Will y'all let Katie and Daniel know that? Okay. You're on mute, Ms. Cobb Hunter, but I think you said that sounds good. So if you'll talk. Okay. If you'll
Katie,
talk.
this is Alan. I would like to do that.
Okay. Yeah. There's no reason for y'all to travel here if you don't have to. So, and so we can take your vote, and Rick's not going to be with us. So Quentin will be running things. So get their numbers, and they'll coordinate with Quentin and get this squared away where y'all can attend remotely.
Okay. Thank you, Mr. Chairman.
Thank you very much.
And Brian, thank you so much. And the guys from God House, I'm muted. No. Thank you for your participation today. Look forward to working with you, and appreciate your help in bringing us up to speed on what's going on your end. All right. Any further questions?
Thank you, Mr. Chairman.
All right. Meeting's hereby adjourned. Thank you, guys.
Thank you, Chairman.
So.